my name is Jessica Nelson, and today I'm going to be demonstrating how to perform a head, ears, eyes, nose, mouth, and throat examination. So to start off, Danielle, my name is Jessica. I'm going to be performing your HEENT examination today. And just so that you're aware, I will be talking with the camera and with you. That way this demonstration can help learners, anybody learn how to do this assessment. So first off today, we're going to be starting with your head, going down to your eyes, then your ears, and going to your nose, mouth, and throat. All right, so starting with your head, what we're looking for is hair distribution and looking at the contour, shape, size of the skull. And I'm going to start palpating it. And what we're looking for is any bumps or depressions of the skull, and there's not any. And then we're going to be looking at the face. So we're looking for facial symmetry as well as any involuntary facial movements, which there aren't. And then next we're going to be going and feeling your temporal pulse. Little artery. And we're also, while we're observing, we're looking for any scarring, any lesions, any crusting of the eyebrows or the eyelashes. So next we're going to move on to the temporal mandibular joint. I'm going to have you open and close your jaw 3 times. So what we're looking for here is any crepitus, which there wasn't any, and that's a good sign. All right, Danielle. So with that, we're going to palpate the sinuses. So first it's the maxillary, or the frontal, excuse me. Then we're going to go down to the maxillary. And is there any tenderness or pain here? That's a good thing. If there was tenderness or pain, that would be a common sign of inflammation or infection that is going on in there. So next we're going to be moving on to your eyes. With the eyebrows and the eyelashes, we did talk about that there wasn't any crusting on there. And with the eyes, we're looking and making sure that they're symmetrical. We're looking at the size, the shape, and the position. We're making sure that there's not any lesions, discharge. We're checking the lacrimal glands, making sure that they're nice and pink. And I'm going to pull down just very gently on your eyelids, making sure that those are pink and that they're not pale at all. And that's what we want. We want them to be pink and not pale. Next, we're going to be looking at the cornea and at the lens. And we're looking at the pupil and the iris. We're looking for any color deviations, and we're making sure that the pupils are round, that they're symmetrical. And so with that, we're checking, whenever we're shining a light, we're checking and making sure that there's not any foreign bodies in your eyes. But we're also checking the pupillary response. So when we do this, we're going to shine a light directly in the patient's eyes. And we're watching for that pupil to restrict. And while we shine a light in this one, we're looking at the opposite one to make sure that is also restricting at the same time. And it is, which that is a good thing. So we're going to check this eye first. And then we're going to check the opposite eye, which it does restrict at the same time. And that's what you want. You want that symmetry. All right. So I'm going to take a step back and I'm going to shine the light in your eyes. And what we're making sure here is that there's light reflective and that it's symmetrical, which it is, and that's a good thing. So I'm going to take a step in and we're going to perform some visual field tests, just checking the visual fields. The first one is going to be checking the peripheral vision. And so this is called the confrontation test. So I'm going to get a little bit closer. I'm going to put my hands off to the side. And I'm going to be moving my fingers, and I want you to tell me, just look straight ahead, and you tell me when you can see these fingers.
Yeah.
Okay, awesome. And we're going to be checking the posterior and the superior angles.
Yeah.
So just moving our fingers.
Yeah.
Awesome. Okay, and that's a good thing that you're able to see that. The next one is the 6 cardinal views of gaze. this tests the extraocular movements and the extraocular muscles. So what I'm going to do is I'm going to have you look straight. I'm going to have you look at this finger, okay? And we're going to move it laterally, up and down, back to midline, laterally again, up and down, back to midline. And then at this point, we're going to move it, go out. So what we're testing there is for convergence. We want to make sure that the eyes converge and that the eyes are able to follow within a 5 to 15 centimeters, which it is, and that's a good thing. All right, so next we're going to take the ophthalmoscope and we're going to do the fundoscopic exam. So with this one, we're going to get a little bit closer now. So I'm going to put my hands on the patient's shoulder. We're going to get at a 15-degree angle. And I'm going to make sure that the ophthalmoscope is up to my eye. And as we're coming in, we're looking at that red reflex in the scope, and we're following it into the patient's pupil. And we'll be checking for the retinal vessels. We're going to be checking the optic disc. We're going to be making sure that the anterior chambers are transparent. So again, we're going to follow. So we didn't see any foreign bodies, which was good. And at this point, we would move on to the next eye and perform the same thing. So moving from the eyes to the ears, we're going to be looking at the ears and checking for the size. We're going to be checking for symmetrical placement, looking at the external ear canals for any drainage, any lesions. All right. So, and we're just looking for any signs of infection that we should be aware of. So this first test is going to be testing your hearing, Danielle. And what I'm going to do is I'm going to occlude the ear, and I'm going to say a 2-syllable, or I'm going to whisper a 2-syllable word, and you're going to repeat it back to me. Okay. We're going to come on this side. Baseball.
Baseball.
Awesome. Okay. And so with that, we're going to next pull the tug test. So this tug test, we pull at the top of the ear, which is called a pinna. And I want you to tell me if there's any pain while doing this, tugging it up and down. That's a good sign. So if there's any tugging on the pinna, then there could be possible, it could be indicating of inflammation or any infections in the internal canal. And you would want to be aware of that before you check with the otoscope in the ear. So next, Danielle, we're going to take the otoscope and attach the speculum. All right, and with this, with a patient who, an adult patient, we're wanting to make sure, let's get the speculum on. Okay, there we go. So with the adult patient, we're going to pull the pinna up and back. We're going to gently put this in, and then we're going to look. And what we're looking for is we're checking for any drainage, abnormal drainage. Oh, there's a pearly white tympanic membrane, which is supposed to be pearly white. We're wanting to make sure that it's not red, pink, any inflammation going on in there. And then we would move on to the next ear and do the same thing with the otoscope. So with that otoscope, we made sure that the tympanic membrane was pearly white. We checked light reflex. It was good. So now we're going to perform the Weber and Rinn test. And this is used using a tuning fork. So Danielle, first is the Weber test, and I'm going to strike this tuning fork, and I'm going to put the end of it in the middle of your forehead. And you're going to tell me which ears you can hear out of, okay? Both. Yep. And that's what they're supposed to hear, is out of both ears. If for some reason they were only able to hear out of one ear, not the other, this could indicate some hearing loss. The next one is the rim test. And I'm going to strike the tuning fork again. And what I'm going to do is put it on the back of the bone right here behind the ear, okay? And you're going to tell me when you can no longer hear it. Okay, good. So we want them to be able to hear it when we bring it forward, because we want them to be, air conduction is greater than bone conduction. And that's what we're testing for with these two tests, is we're testing the conduction of the ears, which your ears have very good conduction. All right. So now that we're done with the eyes, the ears, we're going to move on to the nose. So with the nose, we're looking for any obvious deformities. We're going to take that otoscope again, Danielle, and we're going to be checking inside the nose for any abnormal discharge, any polyps in the nose. The mucosa in the nose should be pink. And with this, we're also checking for nasal deviation, or septal deviation, excuse me. And with that, we want to make sure that there's not any abnormal discharge, and we want to be really careful when placing it in the patient's nose, as we don't want to strike a blood vessel and cause them to have a bloody nose. Okay, next moving on to the mouth and the throat. So first we look at the lips. We are looking for any signs of cracking, any lesions, any sores on her lips, which she does not. We're going to be moving onto the mouth. So Danielle, I'm going to have you open your mouth, stick out your tongue, and say ah. Ah. All right, and while she's saying ah, we're looking for the uvula and making sure that it's midline, making sure that the tonsils are nice and pink, but that they're not having any signs of infection, that there's not any nodules. We're checking the soft palate and the hard palate, making sure that there's no lesions, abnormal discharges. We're also looking at the dental work of the mouth, making sure that they're checking in, seeing if there's anything that we should be aware of. So I'm going to have you open again, and we're going to check underneath your tongue. So this is when we're checking for the subgleal and the submandibular glands, making sure that they're not blocked. And then what I'm going to do is take my two fingers, I'm going to stick them inside your cheeks, and we're going to be checking for any masses. Which there isn't any, and that is a good sign. All right, so now that we checked those subgleal glands, the submandibular gland ducts, we're going to be moving down to the neck. With the neck, what we're looking for is we're checking the alignment, ensuring that the trachea is midline, that there's not any masses, lesions, or twisting of the neck. And we're going to be palpating the lymph nodes. So we're first going to palpate right here, the preauricle, and then we're going to be checking the postcircular, moving down to the postcircular and moving down to the tonsillar, submandibular, and the submental. And then we're going to be checking the anterior cervical and then the posterior cervical. And the posterior cervical is behind the sternocleidomastoid. And then we're going to be going to the supraclavicular, which is above the clavicle, and then below the clavicle, which is the infraclavicular, and then moving to the occipital. So when checking for lymph nodes, what we're checking is that they're pea-sized, that they're non-tender, and that they are movable. If for some reason the lymph nodes are hard, tender and not able to move, not mobile, then that's something we want to be aware of because we want to be able to check and see why this is the cause. There could be some inflammation going on for some reason. So next is we're going to palpate the trachea. This is a little uncomfortable, but we're just checking, moving it side to side, displacing it, making sure that it's midline, okay? And then next is we're going to be checking thyroid. This is also not the most comfortable, but we're going to be checking it anteriorly. And we're going to be checking right here. We're going to be moving it back and forth, just checking the lobes of the thyroid, checking for any nodules, masses, lumps. If you could swallow up and down. Having them swallow up and down is where you can feel, make sure that you're palpating the thyroid. With this, you could visually see if there was any goiters, but we can listen to the thyroid and make sure that there's not any bruits. And we do this by using the end of the stethoscope, the bell. All right, and that, we didn't hear any bruits, so that's a good sign. And this is the end of the examination. So thank you guys so much.